This is Senate Appropriations, April 17th. We're continuing our work on the budget and, what we're going to be doing today is, reviewing again, our one times. And, what we've tried to do is obviously, reflect conversations, and also reflect, bills that we've passed. I don't have a copy, not that I need one.
Oh, there should have been 4 that went down.
And then yesterday, everybody was given a list of all the different requests, and then we're gonna have to determine ultimately how much we make work. Now, we have really 2 things here, just want to clarify. One is where we have actual money available, and that's gonna be the one-time revenues at the top. And it gets really confusing because in the budget contract that came over from the House, you have your one times that actually where you have the money to fund them, and then you have contingent appropriations. So the House had, separate from this, contingent appropriations of 23.5 million for 2 things. 20 million to go toward emergency housing. And then 3.5 million that went to elevate houses that were in flood prone areas in a way of mitigating against future damage. We know based on revenues today that our revenues this year are coming in a bit higher, and that's what we would contingent appropriate. So we have 23.5 that's already come over, which I think people are agreeing in the House. And then the question is how much more we feel there's the potential of funding. So you could make it a huge wish list and everybody would think they're getting something, but you know that the money isn't going to be there to fund it. So that is not how we budget. So we're going to be what we think is a reasonable level of contingent appropriation. But the sheet that we have here is how we're taking the one-time revenues that we have in hand and how we would spend them. So I'm gonna let Emily take it over. We're not gonna go through every one because we've already gone through this and you'll see some are held. And then we just have to come back and decide how we wanna move forward on them. So this is the latest sheet and we will run through it as best we can. And so I want to see how much of it we can just concur with, and then we'll have to determine how much would have to go onto a contingent appropriation and what that would look like. So
Yes, do we know what the bottom line is at all, or we know we do 23.5, but what about, is there other money that?
we have this is money that we know we have.
Yeah.
And it's one time.
Yeah.
What we also know is our revenues for this fiscal year are running ahead of forecast. And that is what we call our contingent appropriation. And that's where the House has identified 23.5 million of contingent for the 2 purposes that I referenced. Now, so this is where we actually, it's not contingent on the money being there. This is money that we have in hand, and that's what we're dealing with here first.
Yep.
So with that, I'm gonna have Emily just run through what this looks like. Revenues, we're still 8.4. Well,
Yes.
if wishes were horses, as they say, we could all ride. So let's,
6 would fly.
we'll have to.
All right, so Emily Byrne from the Joint Fiscal Office. Again, not gonna go through every line. The first couple lines should look familiar, or things that the House did that the Senate has accepted. The first one that's in yellow and in red is the other reversions line. And you'll notice right now we're carrying a difference of 1.05 as compared to the House. The House took 1.05 million from a one-time appropriation at the Agency of Human Services. to fund to, fund, I think, Bridges to Health and the urgent care, mental health urgent care centers line items. It's sort of an open question about whether or not the Senate would like to utilize some of that one-time money and revert it, or leave it for the Agency of Human Services to utilize and close out what the purposes originally was created. So it's just highlighted because it's an open item.
And the agency, I'm sure is going to take the position they need the money, they think the demand is gonna be there.
Possibly.
All right,
The reversion for the pension plus, the next one that's highlighted, 4.7 million. So in the miscellaneous tax bill, the Senate has the Senate Finance Committee has raised some additional revenue from financial regulatory fees. In sort of working between the base budget and the one-time budget, 4.7 is sort of the amount that we felt could come over to be utilized for one-time appropriations at this point. But that's also,
and that's how you get to the 74.
Yeah.
Okay, so now we'll see how we're spending it.
yep. So I won't go through the ones
Please
in
don't.
white. We'll start at that first blue one, the 211 contract on line 10. This one, last time I was in here, we talked about, I believe Senator Perchlik had a memo that indicated that to go to 24.5 as opposed to 24.7 for 211 would be down to $176,000. So with rounding, that 1.8 is 107 goes to the 24 hours a day for 5 days a week.
So, if you wanna, make that adjustment, I don't know, Senator Perchlik, if you wanna give any more explanation of what we got, what you received from, regarding the, 211 vote.
That's what Emily just said, that equals 24 hours for 5 days instead of for 7, it made a big difference. Even though you're only taking out 2 days, there's a big savings there for not having to do it on the weekend. That was offered up by the operator.
They also said staffing is much more difficult. Is that part of
I
their,
think it's more cost.
more costly? So, committee, are you okay with that? So we'll, go back to expanding, but not at the same level, as proposed before. So we'll close that out. The Vermont, let's see, manufactured home improvement.
Yeah, so manufactured home improvement, I think there is still that and VHIP put together. In the sort of larger housing conversation, just haven't really settled on where that lands until that larger housing conversation, some other committees have been.
And we're trying to, coordinate that with, Senator Ron Hinsdale's committee, in terms of what would be the revenues there and what, if you'll notice, the governor had 6 million for VHIP, the House removed it. The extent to which we put it back, or, the bill that's in the Economic, Development Committee actually provides some funding for VHIP, so we're trying to crosswalk from that, the bill that's still to be finalized in that committee. So,
So, but these the numbers that they're, where they haven't got to the recommending level.
they are in the process of recommending levels, but it's not at the level of the 6 million.
Okay.
So the question becomes one of, and the question here ultimately is, do we take some of this housing and put it on our contingent to add to the 23.5 and do the housing sort of as a, something that we fund in that particular way. But there's $1 million right now that's being proposed for VHIP in that other bill. So at a minimum, it would be 5, whether we can fund at the full 6 between the one that's there and, or whether it's 4. We'll
So
have
their bill had 1 million or 5 million?
1 million.
And then,
So the governor proposed 6.
yeah,
So if you take their million, that means, do we want to replace all 5, 4? What would be the right amount for VHIP? Or what is the amount we can,
but
apply?
they're, to be clear, they're in economic development, they're recommending 1 million?
Out of their funding source?
But not, they're not.
That's a one time.
No,
Okay.
no,
Okay.
no. So we're just seeing how much that bill is going to, because it's revenue from the property transfer tax. And right now, my understanding is they're allocating 1 million of those revenues for VDOT. The governor, of course, didn't have any, the 6 was the total, so they are funding at 1 million level. That would bring it down to 5, and the question is ultimately, is 5 the amount that we can allocate? At this point, it's too early to look until we get to how much we have to cut.
And then the House didn't put any in?
No, they put it in their separate housing bill.
Ah.
So we're having to take all those disparate pieces of legislation and prioritize them. And
No, it's just hard on this sheet. It doesn't,
no, it doesn't tell you. You have
Oh,
to
we're
carry
actually-
extra
It's
numbers.
open sheet.
And does that affect, the HCD housing money?
No, no, no.
But it comes from the property transfer.
And in their bill, when they expanded
In their bill.
property transfer tax, that some would go to the HC.
But that's in the other bill.
Right.
So yes,
So-
it would, more would go to VHCD. And more would go toward Act 250 reform, I believe, and regional planning and so forth. So that's, in their bill. So I'm gonna hold, because the question is, what would be the level and whether those, if, in order to get to the bottom line, would we move from in the money to on the contingent list? And at this point, we can't decide till we look, at how much we need to make up here. So let's keep going here. The next one is prop cash, and that's, reflective of the recommendation from our ag committee.
Yeah.
And that is to make sure the money's there for the match, and then you wanted to use the additional money that was freed up to go to the conservation district's one-time money, which is down on line 32.
You know, the remaining difference between the 450, 240, and $100,000, the 112 will be in the base.
I would just say the line through, farm share program at,
That's a 3-to-1 deal.
at the level that we're at. There's a little money for that.
A little
Would
bit.
be into.
Whatever. So that is reflective of your recommendation. But once again, we're restoring the 112,500 in the base. That's on a different sheet. This is one time. And I guess the only thing I can say to people, when you got it one time, does not mean that constitutes your base in future years. And so, that's part of what we're getting here. And so I realized that the conservation districts wanted $3 million. We don't have $3 million. They wanted that last year. So there is some one-time money to help with their work, but I don't know who's here representing them, but once again, if it's one-time money, it means that there's no commitment that we have the capacity to fund it next year.
I think that Rich and I are here.
Okay.
Good.
Okay, now. This should look familiar to Senator Sears.
The next two pieces are related to one-time investments that were on the judiciary spreadsheet that we walked through yesterday. Money for the Vermont network related to the fee change.
That's the difference between the amount that they got versus what they
Yeah.
anticipated.
There's been further conversations about the fee change and how much the center actually lost. And Grady and Chris Ralph, one of them, walked me through that complicated mess. But I feel fairly comfortable with the number that we came up with. It's not 300,000
It's the 300 minus the
minus
They
what they
got.
got.
Now, the next one.
And
we should
Jen
have been some-
Coleman actually wrote and said, yes, okay, with
Well, thank God, that was pretty confusing.
It was all very confusing, but I think it
Been explained.
unexplained and hopefully.
All right, so,
Enough.
shall we remove the hold on that for now? And the recidivism, that partnership, that was something you had,
That's gonna bring in millions of dollars to try to do. Get data, case, like data. For our funders. Which every time we've done any studies of our correctional system, we just don't have data that other states have.
all right,
And it's an unusual match, so that was arranged. A guy I met.
a guy.
A
I know
guy
a
I
guy.
met, I came into the.
That makes me very
I met
proud.
with him and
He was also.
Oh, I know a guy, huh?
I know this guy and, not from Brooklyn.
All right, now the next,
So,
is something I think we've talked about, and we put in 25,000 last year. And that is for a memorial, which was part of that whole therapeutic and healing process for the adults who actually experienced, sort of very unfortunate treatment at St. Joseph's. So this is, I think, would finish what they need to, have the memorial there.
Yeah,
And I would say that we would want to do that, and help them finish that. So that goes for the 25 we did last year. DEVA, there are a couple of things here. One is, a market study that, Stephanie has recommended is really important. And the other is, the startup, and the level yet is to be, and this is on the Medicare cliff. You have to have some startup, and you have to do some advanced work if you're going to implement any of those, if you're gonna implement that, program for, enhancement to Medicaid to deal with when you turn 65, the hard economic impact that has. So that is, if we decide we want to move forward, you gotta fund the upfront work. What?
there a Beatles song, I turned 65.
Oh, yes, yes. Will you still love me?
64.
Will you still love me?
It was 64.
Thanks.
Close enough.
This is, once again, this is new, number 37. This is something that actually was first brought to our attention by former Senator Jim Ash. It's something that VSEA has requested. It's something that, our Gov Ops committee looking at, costs of healthcare for employees, and that is to look at reference-based pricing. It's a concept that was experimented in Montreal in Montana. And it cost 15,000, and I think Senator Lyons knows that this would actually dovetail with some other work the Green Mountain Care Board is doing. So this is
Well,
not
it's
20,
a really cost-effective study. If with this study, I think the next study should be how this type of pricing funding jives with any of our payment reform. So,
Yes.
yeah, because they're significantly different.
Just to know. Okay. And it's 15, it's not.
Yeah, no, it's 15.
And we do have some language, and Owen Foster of the Green Mountain Care Board indicated that they could plug this. I think Brand is doing work for them, and this be part of that analysis. The SEA also had three other studies that would be 75,000. This is, this seems to be the number one priority, and that's why it's showing here. The other ones are on the list and yet to be, just whether there's funding or not. Adult days, that is to, do the upfront work to get an adult day program operational again in Washington County. And, that was 80,000, I think it was like 78, we rounded off to 80. You wanna change your mind on that? Okay. Let's go
I'm not saying anything.
on.
I do my work for Senator Birchliff every day.
Good. Well, I'm just working for everybody because I don't have anything on this list.
This will be the last list of this.
No, it's.
not listed.
No. And then the one-time transfers, we reviewed that. I don't think we need to go through that again. And then, the Senate bills.
That is a lot.
People wanted to be very busy. So, I think now that we're down to 213. And I must admit, in my mind, as I've been trying to work out all these figures, I thought the ongoing, I didn't realize that the fiscal note had not been updated. And so I thought the ongoing base cost of 213 was 2.4 million. Well, actually, it's 3.7 million. And so, Senator Bray did prioritize, but he was prioritizing off 3.7, not 2.4. So, we have got to go back and relook at the base, but this is one time, and we just need to, get this firmed up between, what we put in for one times and then how much we can put for those ongoing base costs. And is there anything here, Emily, that you want to add? Obviously, capitalizing on, say, that would go, the governor already has $1 million. So if we did the full 1.5, that gets it up to 2.5. Emily said that in fact, capitalizing it, we probably would have to do over a 5-year period of time. So this is not exactly, the end of what would be needed for that loan fund. The other, so the other, 310, and then I think we had agreed, we closed that out, that had to do with just because you got flooded 4 days after the July flood. You get treated the same. And then the only other one, which is in here, and when we passed 310 out, urban search and rescue was in for 250. In the public hearing, the testimony was that they would like 750. So, I asked the chair, well, why did your bill had 250? Why are you now asking us for 750? And it was about, they just went with what was requested. But, so I just want to go back memory lane. It was 250 in the bill that we pulled, and we pulled the appropriation out. So that is, to me, something that we could probably discuss, a little bit more.
That's 259, the super fund bill.
Yes,
That we're borrowing money in future,
we're doing it on cash flow.
on cash flow, so it's not gonna show up in budget. Correct,
No, that's right. We did that with cannabis too.
right.
And so we're funding those
Anticipating
upfront,
future,
and then we'll reimburse ourselves with those future recoveries. So that's how we're gonna deal with
that's what I
that.
thought, so it wouldn't show up here.
No. Now, the question that I have, if you've all looked at the list, are there, other, items that we don't have that you would say we need to consider? So,
In any.
the which,
Are we gonna
Oh,
get
it's in there. but,
contingent?
yeah, well, we're gonna have to outline, how much, now, if we move, in order to balance this, if we move the VDIP at whatever amount and manufactured home onto that, then we're up to 23, and then you add that, you're
Yeah.
moving right up, against what you have. The other, priorities, for one times. All right, and, that is Sash. And, I tried to reconstruct what we did last year, but we gave them 450,000 one time. So the question is, are you asking for 300,000 one time for Sash?
Yes,
All right, so that's gonna be added. Obviously, if that's something that, we'll have to add,
How much?
was 300,000. 300.
okay, 300. You're right.
Right there.
There it is.
Yeah. And then, some of those were ongoing, those were dates.
Yeah, the other ones are theirs. That was the other, anyway, but that the only,
And then you need to, that's opioid.
that's all set with the opioid settlement.
And do, okay,
And
and,
it balances out.
and that would have to be all updated, right? For
Yeah.
Okay, for whatever your allocation of.
Yes,
Now,
we have a fiscal note. We're passing the bill out tomorrow with the fiscal note.
just a reminder, in the House passed budget, which we did not agree with, remember they took, base out of the community coalitions and, replaced it with opioid settlement, which is taking base and replacing it with one time. We said, no, we will not do that. So that freed up opioid settlement money. And I assume that in your construct, then you were assuming you're spending it. Okay, that's all I wanted to.
And it does spend down the fund as it currently exists, but money continues to come in. It spends it down to within about $30,000.
The settlement fund.
Yeah.
Now, because what we did do is say, no, we are not gonna, take the money, and we had Dr. Levine and say, we're not taking base money, using it to grow a base somewhere else and replacing non-going funds with one-time money. That meant that the money that the House had proposed to respond to the Recovery Center request of about $1.5 million is now on our list of how does that increase look like and get prioritized against all the other funding requests. And, I know that we did put fairly significant increase in the recovery residents and the program, so I don't know, $1.5 million against what we have must be a very significant increase in that particular area of spending. And so I've asked joint fiscal to give us some sense of, the request relative to what is allocated, because it's in there against other base increases, and we do have, obviously, the big one that has been identified in addition to judiciary, and that is, increasing of, the, community providers that in the governor's budget and in the House budget and in none of the House passed budgets, increases to the DAs, the SSAs, the parent-child centers, our services that, are there for seniors. So, we are, addressing those areas of spending. So, okay, Emily, now we've gotten through here, so we're only 8.4 in the hole.
Yeah.
Well, that's not too bad. Yes,
What, there's a server earnings on our one time, but we were being part of it from over here.
yeah,
We should deal with that when we do with it.
we're gonna have to look at contingent funding. And so if we move, and this committee has always been, very supportive. It's a program that's been started and it's a consortium. Three, programs working together, Youth Conservation Corps, Vermont Works for Women, and, Audubon. And, it really is a program for job experience and skills development for people that are really on the margins of our workforce. So we have a lot of emphasis on, the professional, occupations and loan repayments and scholarships. This is the one program that serves Vermonters who are really needing basic skills to enter the workforce. And, they had 2.3 million. And so what Senator Perchlik and I were talking about is, can we start doing some kind of base support for that workforce development program. And then how much would we, if we can do it, how much we would put on our one time to support the same level of service to this group of Vermont workers. Some of whom actually are getting services through vocational rehabilitation, and they're doing a lot of work that benefits the community in terms of on our forest and parks, property and so forth. So this is getting into, if we're going to move into that contingent list, then what makes sense to move from here onto the contingent appropriation and what should we put here? And so, I think in addition to the, we're gonna go over, SASH, this would be one that we would put on that list. And then any others that, and just sort of move through and see, but, obviously, we've got 8 million here, and so there is a lot more.
40,000 one time for empty arms.
That's a new program, and they'll have to go on for. That was an example of a grant program that got started, and I would suggest if doula gets covered, one would suggest that the description of what a doula does, in fact, would carry you right through to the, to whatever happened with that pregnancy. So it's a new program, and, it's new in the sense of it was a grant, and so now the grant's ended, so come back, and the question becomes one of just priority. But it's on your list. The other, thing that we were going to do, and I don't know if Grady's got the language, but, in the, ARPA sweep. People know what the ARPA sweep is? Well, you just failed the course.
September.
In September,
I abstain.
the first 40 million. If that is made available, 36 million of it would go for necessary FEMA match and then other kinds of municipal assistance that is not eligible for FEMA. So in 10, we created a fund, and so we're gonna add language that any of that money, if it's available, that's not needed for FEMA match, would go into that municipal trust fund. And then could be used to, support municipal projects that are FEMA eligible. So we're adding language there on that 40 million. The next 30 million, as proposed by the House, would go to VHCB. And we are going to add language that has been recommended that would say out of the amount going to VHCB, if it were 30, then 10 would go, would be allocated for housing for people with disabilities who are part of the Medicaid home community-based program. We have some language from, and, or if it's less than 30, then a third, because if 10 is a third of 30, then if it came in at 25, then you would just proportionate. So that is, and the other part of language that has been suggested is when we put in the VHIP language, that we also amend the statute to make one of the households for people with disabilities. That's one of the priorities, was homelessness and, you know, things like that.
And Ginny, is that the language that got pulled out of the housing bill that's in Teresa's?
No,
There's
no,
some
no, this
language,
would be in patients.
It's
when
in,
it-
yeah, it's in
Okay.
economic development.
because there was some language that I remember I brought it into your
The
committee.
VHIP,
Was that?
you talking about the VHIP, yeah, VHIP, I brought it, it's in here.
It's in here, we'll
Okay.
make that.
We got it.
Okay.
Yeah.
Just want to make sure that.
And then, what we're still working on is, emergency housing. And just for people to understand the pressure that this puts on the budget. Prior to COVID, we did not have a specific appropriation for emergency housing. It was just funded out of GA. This budget, and collectively, between the 20 million contingent, between the 7.5 million that we added to the GA base last year, plus the 7.2 for emergency housing, and the 20, we are talking about $44 million that was not spent on emergency housing prior to COVID. So everybody who was here, you can see how much pressure that is putting on all the other areas and programs, services and programs,
So
state government.
I must be misunderstanding something, because the other day when we talked about this, you ran those same numbers and you totaled it up to 44. I get 54 or 55.
No, I don't think so. It's 16.5 one time in the governor's, and then there was 7.2 emergency housing, 7.5, which is in the base already,
And
and
that's
then
one.
20 million.
That's 50.
There's 7.2, so there's 7.5 in the base for GA housing, then there's 7.2 for temporary emergency shelter. That's for shelter.
Okay, so that's 14 plus.
That's 14 plus, and so I think some point in the apples to apples conversations, the 7.2 isn't for motels. So that would be for shelter beds.
Yeah.
So that's
Okay.
not.
So that's, I'm just adding it all
Okay.
up. But
Yeah.
I'm just wanting to give people some sense of why this budget is so difficult. And so, when you're saying, gee, why couldn't we give mental health 6%? Or why didn't, the one thing that's not on here is no increase for our reach up benefits. So our poorest families are not on the list. And so this, within this budgetary construct, I just need to bring home, when you pull nearly $50 million of spending toward one area, everybody else is experiencing the impact. That's my only reason for stating it, that I know that we're all getting emails about, what the program should do or not do. But when you sit around the table, you can see some of the kind of insidious impacts it's having in terms of the services and benefits to other very poor Vermonters and vulnerable Vermonters. So it's really a moral dilemma in some regards when you're dealing with what you have for resources. So I'm only bringing it up because when you're looking here and when you're looking at what the base increases are and the 3% for community-based organizations, and you're saying, why can't it be more? If you had $40 million more, it would make a very big difference, and we don't. So I'm just stating for anybody who's here, and it's not just for the committee, to keep in mind that we have a very different budgetary environment and competition for funds than we had just a few years ago.
Well, that's brand new spending. I mean, during the pandemic, we were spending the federal money. Now we're spending our own money. And I mean, some people think I'm mean about trying to curb that, but it's around this table and the folks upstairs that okays all that. And I mean, we should be drilling down on that because, as you said, our designated agencies, I mean, we've got thousands of people that are struggling that we can't help adequately because we're renting these motel rooms and it's not right.
Well, it just shows that, all I can think of is when George H.W. Bush said, why didn't you go into Iraq? And he said, because there's no exit plan. And I sort of feel like perhaps that's exactly the position we're in. But it obviously makes a big difference in terms of the decisions that we have before us and what we're able to do to respond to some of the requests.
Yeah, Colin Powell called it the Pottery Barn rule.
Yeah,
If you break it, you own it. And
yeah.
could argue that it's broken and you're trying to figure out.
What the exit strategy is.
Right.
So, I'm going to, suggest that, we have an opportunity before we take a break. Are there other things? We've talked about adding the SASH request, a serve, earn and learn. And then we've got to, figure out what we're doing with 213 in terms of the one times on that.
I would just advocate generally around 213. If I had to name one priority this session, it was flooding. And I think 213 is the most comprehensive and forward-looking bill we have. So if it hurts to go a little higher on the funding, I would suggest that we do that, even if it hurts. Because 10 years from now, I think that's a bill we're going to look back at as having saved us a lot of money down the line.
And that will be in two different places, one of which is the one times. And then what we're able to do for the ongoing base.
Yeah.
So, other comments in terms of, I realize we've got other lists, we've got the request. Once again, we have the Howard Center Cultural Liaisons, that's in the grant that was gotten, it's now ended. So the standard, now the grant's gone, we want to be funded. Housing for people with disabilities, I think we've taken care of that, that was 10 million, that's a fairly significant, I think, piece of policy to allocate. My understanding is that, that would perhaps, allow us to develop more what are called intentional communities, like Heartbeat and, wonderful programs for, and I know that parents of adult children, they're adults, but and the parents are really concerned about when they're not able to care for their adult child, what they have for housing. So I think the allocation of the 10 million is a step forward on that as well. So, and the EMS training we took care of, so, and then.
Right, and we did
the-
pass that bill out today,
The EMS,
and well, and we're voting it off.
and we did put money into it already,
Mm-hmm.
because the insurance adjustment. So I don't think that's additional funding.
But no, the insurance piece is in here, so for the non-transport services. Sorry, here.
Oh,
Payment for non-transport services, EMS services.
EMS training you have.
Right, but there's also,
No, that's ambulance, services,
Oh,
that's
okay.
emergency we have two things, one of which is, Medicaid reimbursement when you have to be taken to a
Right.
hospital, and then the other is non-emergency medical.
Right.
And that was something that's not in the house, and we have to put it in, it's about 500,000. And it is a requirement of Medicaid to assure access to healthcare. So you can get to the doctor or the dentist, and the methodology that DEVA had actually resulted in our public transit agencies not having their costs covered because of, as I've mentioned before, they're doing so many daily trips to methadone clinics, or they've had to do expensive trips to Boston for specialized care. So DEVA's redoing the methodology, but in the meantime, have to do something to adequately reimburse. And so on the, that's on the base, I believe, base
Here,
list.
too.
it is,
There's non-emergency transport is on here.
Is it on here?
Mine's
Oh,
coming down.
yes.
okay, that's the
That's the
bridge
first one.
to,
Right,
when they
sure.
do the methodology. So it's 500,000.
There's 74,000, 31,000 GF for when they go to an emergency and then they don't
Right,
transport.
they didn't go transport, that's the 74.
That's 74,000, and then you have 300,000 special fund. They go for that.
Well, that isn't on the list then at this.
So I think we have to
point.
update it based on what just
Yes.
passed, so we can do that.
Okay. All right,
They charge you when they go to an emergency, but don't transport.
They don't get charged, they don't get paid.
Oh,
Yeah, they just go and help them.
yeah, right, sort of like.
yes, Amy.
Well, I can ask you.
So,
Police go to a port, they don't get paid.
so I'm, going to suggest, now let me ask before we sort of take a break. Do we have more language that people are working on? And I know certainly Health and Welfare does. Senator Bruce.
Around the 3.5 for the raising of the structures to the house, all it said was raise structures. So I'm working on language that would
Put it in the fund.
put it into the fund that was created in F310,
Mhm.
and also some language about parameters, so that the house will be inhabited and that they have insurance to fix it up, so you're raising a shell of the house. Those kinds of things to be added, so that when public safety runs the program, they know.
Should we bring that up?
And then I had that one small piece around,
Something BCB,
PCB.
is it everybody, where is Grady?
The office.
Oh, all right.
He's probably listening.
No, it's fine. All right, so I'm just needing to keep a list. I feel like Santa Claus checking twice.
You need more help.
So we need the PCB, which we've actually grabbed on. The other language is 3.5 million to go into the municipal mitigation river fund, the 310 fund. I have some language that's requested by the treasurer, and that is to adjust the percentages for contributions for the Beamers group, which is municipal employees. And we would have that to add. Yes,
The language on fuel assistance yesterday that we got stopped at,
Shell.
I got an email back from Chris Winters, and he said that they were supportive of that language, they understood that it might cost, and it would force them to manage more, but he said he was.
That was the shell to may as far as limiting it to one.
yeah, I know. He's okay with it?
He's okay with it, I can show you the.
All right, so that's not a change, it's just keeping the language.
No, that was, the
What's that?
request was to change the language. The shell.
It wasn't in the House bill? That was new language, that's what I'm just asking.
Yeah, it was new language.
Emergency fuel
We
language, okay.
we need language for the family support worker in the office of Defender General that's in DC, to transfer that under the 50,000.
Does that mean language? Okay, yeah, I know it's budget neutral, so it's moving the approach. Do we need language?
Right now.
I can talk to Grady about it.
I think we do because former chair Mary did into language in a budget a few years back.
I'll take a look
And
at
we
that.
also need language on the Center for Crime Victim Services, that position. Revenue.
I thought that position got rid of the attorney general,
I mean, moving it to the Attorney General.
yeah.
Yeah.
Do we need it?
The position was already at the AGO.
I think so.
Position as presented.
And then they just
Okay.
funded it fully at the attorney
Okay, so
general,
we
and
don't
left
need
the
any
43
language on
there. I don't think so.
Okay, it's just did you want me to forward you?
I got it.
You got it.
Anything else?
Got that
What?
language area.
Oh, but it doesn't have a direct appropriation.
No, but,
But
Public
we should-
engineering program.
oh, yeah,
It
we did that.
did the PIP, the language nursing.
Oh, the nursing language.
Yes.
Yes, for long-term care folks.
Oh,
Yes.
are you talking about the incentive potential? Hiring incentive? No?
You wanna go ahead,
Well, if you don't play your hand now, you might lose your chance.
that's why I'm trying to, we talked about the contracts that went in nursing homes, with you before.
And that's why we have money, right? For long.
Well,
No. This is different. This is, the contracts that some of the traveling nurses sign, and there's lack of transparency with those contracts. So we're trying to sort out how to understand what's there and what pressures those contracts place on the nurses themselves.
That belongs in judiciary, then that's contractual language.
I don't know, I think we should look at it here, because it does have implications.
We have language drafted and Amy has the edge.
I'm just wondering, I read the,
Sorry, I wasn't paying attention. I was still reading the email from that Larry.
Why are we concerned about that?
well,
Because it costs extra money in the healthcare system, so what we're going to understand. If, suppose a nurse signs a contract, and the only way that that nurse can get out of the contract and stay in the state and not be a traveler is to pay,
yeah, I know,
money.
I
Okay,
know,
so
you have to buy them out.
might have to do that. So we're trying to understand what actually is in those contracts that would have an effect on our healthcare costs and appropriations to this in the state.
Yeah, it's a huge impact, I don't even question, there's a huge fiscal impact, I don't know. When you're getting into contract law, I'm just.
It's really a study. It's not.
Oh, no.
That's a summer job.
An analysis.
Well, who would do it? The Attorney General's office. It seems to me if you're talking about,
That's a
contract,
contract.
I don't know, do we have?
We've got language that, instructs you, the Human Services Agency, with the Attorney General to look at it, but we do have language for you to look at.
We can look at it. If it doesn't fit, we'll give it to judiciary.
Well, I don't know if the jurisdictional position, when you're getting into, because I know that people have had issues around contracts, for example, franchise contracts, where all of a sudden, like for a pizza, franchise, they've signed the contract and then they discover exactly what's required. And since I don't think we were able, the Attorney General's office, I think once you've entered into those contracts, whether it's wise or not, legally, I'm not sure what your remedy is, but, has this been discussed with the Attorney General's office?
I believe there was a link between, ledge counsel and AG. I'm not really.
Because,
Bad.
well, contract law is its own, specialized area, so, all right, anything else on my list?
The expenditures in the housing bill, that would be funded with the property transfer tax. Where it does show.
They would be in the bill itself, so that would be,
They would have to show up.
Now,
well, we can do an appropriation directly in that bill, as long as we're coordinating and know what's in there.
Okay.
So yes, we can.
And as long as it passes.
Well, yes,
otherwise.
and the governor signs it.
Right.
So unless anybody else wants to add to this list, we will, take a break, and shall we come back at 3?